Good afternoon, everyone. It's certainly been a very busy week, and last night the Board of Supervisors had our second public hearing on our budget process and had a lot of speakers, some very good suggestions that came in, and I want to thank the many residents who took the time to call in and share with us their concerns and their suggestions about putting together this next year's or this current year's budget. Wanted to take an opportunity just to give a little bit of an update in regards to the border test site, which is at the Ped East crossing. We just opened that up yesterday, and on Wednesday we had 78 people get tested. Today, again, the hours were from 6:30 to 10:30. We had 118 tests that were given today. The hours of operation are going to continue from 6:30 to 10:30 through tomorrow. But the really good news is starting Monday, we're going to actually be extending those hours from 6:30 to 12 noon. And again, we've been very pleased with the response we've seen and appreciate everybody's cooperation, particularly Customs and Border Protection. They've been extremely helpful in allowing us to use the site that we're using. Today, we're going to get straight into our updates. I know there's likely to be many questions on the improving case numbers, which is good news, and on schools reopening. So we're going to go ahead and get started right now by calling up Supervisor Nathan Flesher.
Thank you, and good afternoon. Our message today is clear that we are seeing progress, particularly in the recent week and in the recent days in what we're doing. But we are in the middle of a marathon. It is not a sprint to a finish line that is right in front of us. It is a daily race that we have to continue to run to slow the spread and lower our case count. Today represents our second consecutive day of having a case count below the 100 per 100,000 per state guidance. We need a third consecutive day, which could possibly happen tomorrow, to be removed from the state monitoring list. But the goal of our exercise is not to get off the state monitoring list and get our case count below that. The goal is to have it remain below that. And we have to avoid the temptation or mindset that if tomorrow's numbers are under 100, somehow we feel like we've made it, we're done, we can go back to normal. That is the same mindset that created the significant surge and spike that we saw at the outset. And so we have to maintain our vigilance. Our goal is to continue to get that case count down, but most importantly, to keep it down. We want to avoid the seesaw of up and down, open and closed. And in order for us to do that, we need to see sustained periods of time where we have lowered the community spread, we've lowered the rates of transmission, and we remain off of the guidance. And so we want to continue to have the vigilance. We want to continue to have the focus that we have seen over the course of the last month that has seen our region do incredibly well. I believe we're one of the first counties that potentially could come off tomorrow. Again, we have to see what tomorrow's numbers bring. But yesterday we were below the state guidance. Today we're below the state guidance. Tomorrow, if we're below the state guidance, then that will remove us from the state monitoring list. But it is very important that we be absolutely clear that just because we come off the state monitoring list per state guidance and orders does not change the current restrictions that were put in place on a handful of indoor settings. Those restrictions were put in place by the state. They are not automatically rescinded or lifted if we come off the monitoring list. We've asked the state for additional information and clarity about when they might consider changing those restrictions or lifting those restrictions, but as it stands right now, they will not be removed. If we get additional guidance, which we could get, we will certainly share that. But if we are successful tomorrow and having our numbers again below that threshold, it will remove us from the state monitoring list, but it will not change the current posture and nature in which we are operating under. I think it is undeniable that we had a significant increase in cases. Actions were taken. The number of cases have come down. And so it's clear that the actions that were taken certainly contributed to our lowering case count, and we will continue to work with the state to get additional guidance moving forward. But the good news is we're headed in the right direction. We are trending down. We want to continue to trend down. And we want to make sure that we maintain our vigilance and our posture so that we can stay low and stay off the state monitoring website. The one possible impact that will come is if we come off the state monitoring list, meaning we have 3 consecutive days with our case counts below 100 per 100,000 per the state's calculation. If we come off that list, then we start a new clock of 14 days. And if we have 14 consecutive days after the 3, starts a new one, we have 14 consecutive days, then all K through 12 schools at their own discretion, consistent with the state guidance, posting a safe reopening plan, but all K through 12 schools would be able to open moving forward. Now, prior to that time of 14 consecutive days, we are receiving and reviewing applications from elementary schools requesting a waiver that could open. To date, we have received 48 waiver applications. Our county staff are reviewing those, working with school districts. Every morning, we are going to reconcile the number of schools that have applied, and we will be posting that on our website at coronavirus-sd.com for transparency. That just simply represents those that have sent us applications. Once our public health experts review those applications, they will send them to the state. The state can give input or guidance. If we don't hear back in 3 days, then those will be approved, and the ones that are approved will also be posted on our website. We don't have any that have been submitted to the state yet, and we don't have any that have been approved yet. But when we do, you will see on our website the list of those that have applied, and then as ones get approved, that list will be updated with those. And so we will continue to keep you posted on all of those efforts. But again, we're making progress as a region, and we're doing good, but we really do have to understand this is a marathon. It is not a sprint. The finish line is not tomorrow if our case counts are under 100. The finish line is getting our numbers down, keeping them down, and then working collaboratively to get as much of our life and society safely reopened in a manner and posture where we can keep our case count low. With that, let's jump into today's numbers. Today we're reporting a 7-day average of daily tests at 7,972, again, well in excess of our goal. Our 14-day percentage of positive is 4.6, and we're closing in on 700,000 total tests reported. Again, the good news, our case investigations and contact tracing are both going very well, above our goal, along with above our metric, and almost 38,000 total case investigations performed, and you can see the treatment numbers there on the other side. For today's totals, we're reporting 266 new daily positive cases out of the 8,020 that we've seen for a daily positivity rate of 3% for today. And again, on the purple line there, you see the rolling 14-day average, which again is trending in a good direction in terms of trending down. Next, in terms of our hospital census, our ICU, COVID-related ICU, is exactly where it was yesterday, up just a few from the day before. Non-COVID numbers are down a little bit yesterday to today, but again, a general trend that you can see there that has been positive related to hospital utilization and usage. The next chart, we're going to look at total hospitalizations. You see the COVID 319 on the bottom there, non-COVID 4,367. So again, below the 80% occupancy and guidance we're looking at. And final chart here is just ICU utilization. You see the 115 that are COVID below, the 351, putting us at 66% of our ICU beds presently being occupied. Again, holding very stable and steady. That concludes my report. I'll now turn it over to Dr. Wooten for her Public Health Officer's update.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and welcome to today's briefing. Today's global, national, and state statistics are based on data that we retrieve from the Johns Hopkins dashboard every day about noon, and the information is seen here on this slide. Today's statistics for San Diego County are from reports as of 11:59 p.m. yesterday. Today, there is a total of 33,659 cases, which is 266 more cases than yesterday. Please go to the next slide. This number is an increase in the new cases since yesterday's report of 236 cases. The overall total number of cases includes 615 deaths, and 7 new deaths were reported since yesterday. On the next slide, the age range of cases is from 3 months to 102 years of age, and also the total number of individuals between 20 and 49 years of age remains at 59%, represented by 19,909. Actually, please go back to the prior slide. Thank you. 17,274, or 51% of all cases are female, 16,281, or 49% are male, and we do not have information for 104 individuals. 2,809, or 8% of all of our cases, have been hospitalized, and the 699 of these hospitalized cases have been admitted to the ICU. This number is 2% of the total number of cases and 25% of those individuals that were hospitalized. Now, when we talk further about hospitalization, the 2,809 hospitalizations, individuals 50 years of age and over represent the majority of those who have been hospitalized, and this is 71%, or 1,985 cases. Males represent the majority at 54%, which is 1,524 cases, and Hispanics or Latinos represent the majority of those hospitalized at 61%, which is 1,604 cases. Now, when we talk further about deaths, this is in the next slide, deaths represent 1.8 of the total number of cases, which is our county's case fatality ratio. And of the deaths, 266, or 43%, were female, and 349, or 57%, were male. 589, or 96% of total death cases had underlying medical conditions. And in the next slide, we'd just like to go over just a little more information about underlying medical conditions. Through August 8th, this is the list of common underlying medical conditions associated with COVID-19 deaths. The top 5 conditions include hypertension, diabetes, cardiovascular disease, dementia/Alzheimer's, and chronic kidney disease. This leaves 26 individuals, or 4% of the total number of deaths, that did not have any underlying medical conditions, and that's the last item on this graphic. So now I would like to extend our deepest sympathies and condolences to the families and friends of those individuals who have lost their lives to COVID-19, and particularly to those individuals that we announced today. Next, I would like to bring attention to the summary of all of our outbreaks on this table. Since the beginning of the pandemic, 341 total outbreaks have occurred in 3 categories: skilled nursing facilities, other congregate settings, and community settings. Community settings is one of our county's 13 triggers, which I will discuss in more detail shortly. Of the 341 outbreaks, 221, or 65%, are now closed or inactive, which means there have been no active cases in the last 14 days or longer. This leaves 120, or 35%, of the 341 outbreaks that are active outbreaks. And of these, 32, or 37%, are in our skilled nursing facilities. And as a reminder, we have 86 skilled nursing facilities in San Diego County. In total, there have been 780 residents and 501 staff members with a laboratory-confirmed COVID-19, and this includes 150 deaths. 29, or 24%, of the 120 active outbreaks are in non-skilled nursing facilities or other congregate settings. In this category, there have been 706 residents and 541 staff members reported, and this includes 99 deaths. 59, or 49%, of the 120 currently active outbreaks are in community setting locations. Since March, the total number of community setting outbreaks have produced 1,389 confirmed cases, including a total of 11 deaths. So this slide shows all, again, active and inactive community setting outbreaks since March 25th. That's the next slide. And note that June and July with the largest, but these 2 months had the largest number before August, the largest number of cases. And in the next couple of slides, what I would like to do is show where those are. But this is all community setting outbreaks, and there are three primary categories that represent these 191 outbreaks, or 1,389 cases. They are first in restaurants and restaurants/bars on the far right. On the far left, businesses, 46 outbreaks, and then the third is healthcare settings. In the next slide, this is again for the months of June and July, and it also shows the outbreaks during those 2 months. 127 outbreaks representing 745 cases, and the three common settings are also the same as the overall group, and that includes restaurants and restaurants/bars. Second is businesses, and then the third is healthcare. The blue bar represents June, and the orange bar represents July. And as you may recall, in the middle of June, businesses and sectors opened up, and as a result of the increasing number of cases and outbreaks, the state issued restrictions in mid-July. And this is the results of the actions of opening up in June. And we are reporting information when we look at our triggers that will show the results of the restrictions that were imposed. Going to the next slide. This is just another visualization of that same information in a table format, showing the three categories again: restaurants and restaurants/bars, businesses, and healthcare settings. In the next slide, I'd like to turn our attention now to review our 13 triggers, and we are very happy to announce that in the last 6 weeks or so, we had 3 abnormal triggers, and now we have only 1. Previously, case rates and then testing positivity, as well as community outbreaks. And we continue to have community outbreaks cited as one of our abnormal triggers. These triggers, in general, help to determine what actions we will take in modifying the health officer's order. And this is both at the state level, as has been already shown by restrictions imposed, but primarily at the local level. So I am happy again to announce that as of yesterday, only one of the 13 triggers is in the red. That's trigger number 2. Yesterday, trigger number 1, which is the case rate, was in the green for the first time and below 100 per 100,000 population. And the case rate at that time was yesterday 98.4 for the county and 94.1 based on the state's calculation of this particular metric. Today, the case rate is 96.5 for the county and 98.3 for the state. There are commonly asked questions as to why there's a variation. The difference between the county and state calculations are due to possible reasons. We do not include correctional inmate cases. The state, rather, does not include correctional inmate cases in their calculations, but the County of San Diego does. And we had the option to do either or when we submitted our attestation application back in May, and we did not exclude inmates. And also, another possible explanation is that the state may be one day behind in calculating this particular metric. But in any case, when it comes to coming off the state's county monitoring list, we will go with the state metric. Now, an explanation actually of how to calculate the case rate is found on our county's website at www.coronavirus-sd.com. The next 2 slides provide an explanation. This is actually the case rates and all of the other 5 metrics that are utilized for the state's monitoring list. So this is provided for your convenience. In the next slide, what we want to do here now is further expand on what Supervisor Fletcher talked about with the monitoring list and how that impacts our schools. So again, to get off of the state's monitoring list, we have to have 3 days where our data are normal, not elevated above 100 per 100,000 population. So 3 days, and then on the 4th day, that means that the county is off the monitoring list, and we begin countdown for that 14-day period for schools to be open. If we go to the next slide, this gives an example of the actual dates. Our first day of being off the state's monitoring list was yesterday, Wednesday, August 12th, today, Thursday, August 13th, and tomorrow, Friday, August 14th, will be the 3rd day. On Saturday, we will begin the countdown, day 1 of the 14-day period, and after that 14-day period, after Friday, August 28th, San Diego County schools should be able to open, and this is K through 12. They should be able to open in-person education at their discretion. So going to the next slide, let's talk specifically about the number 2 trigger on our triggers dashboard, and that is community setting outbreaks. For the period in the last 7 days, from August 6th through August 12th, we have 22 outbreaks, and this shows the daily numbers characterized here. In the next slide, this shows those 22 outbreaks by community setting locations. We have 11 businesses, 3 government outbreaks in 3 government settings, and 2 each for grocery, restaurant, and restaurant/bars, and then 1 each for food processing facility and a gym. In the next slide, these are the 2 newest community setting outbreaks that were reported today, and 1 in a business and 1 again in a food processing facility. In our next slide, again, just want to point out that we have normalized trigger number 11, which is our case investigations, and as you'll see there, we are at 96%. So we are happy about the resolution and the normalization of this particular metric. Thank you. Going on to the next slide. We just want to remind everyone, and actually thank everyone, that this pandemic, as Supervisor Fletcher stated, is still ongoing. We are in a marathon here, and things are not going to end once we come off the state monitoring list. So the majority of San Diegans are doing their part, and we thank you. Kudos goes out to all of the businesses and all of those that have participated in helping to make our results normalize, those that have done so to date. Continuing these efforts will require that everyone does their part and adhere to those best practices that we commonly talk about every day. Washing your hands and promoting sanitation practices in businesses, staying 6 feet apart, wearing face coverings when you're out in public, and avoiding crowds and staying at home if you're sick. These are all important guidelines to adhere to, and we thank you for what you have done to date. Now, please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. We're going to go directly to the calls. Let's go to our first caller.
John Carroll, KPBS. Please state your question.
Yes, thank you. The state has apparently frozen its website that tracks who's on and off the monitoring list. So does the state agree with us that today is, in fact, day 2 below the threshold? And I have a follow-up. Thank you.
Okay, Dr. Wooten's going to respond.
So for the first question, yes, the state does. We actually had conversations with them today, and we have a meeting scheduled tomorrow to determine next steps and any scenarios that could happen that might throw us off track. Thank you. And what's your next question?
Do we know about other counties that have come off the watch list? Are they in the same boat as we are?
To our knowledge, no other counties have yet come off the watch list, so I'm sure this, as the governor does his briefings, periodic briefings, he will inform the community of who is and who is not on the watch list. Thank you.
Thank you.
Okay, we'll go to the next question.
Sasha Fu, KUSI.
Yes, good afternoon, everyone. I have two questions. The first one refers to the references to the need for sustained progress even after we come off the watch list. At what point might the county be able to consider relaxing some of the rules regarding the operation of gyms and indoor dining and personal care services?
Okay, Dr. Wooten's going to respond.
Thank you, Sasha, for the opportunity to clarify and provide that information. Coming off of the state's county monitoring list, the impact at this point in time is only to schools K through 12. In terms of opening up of other businesses, as Supervisor Fletcher and others have stated, the monitoring list has no impact there until we get further direction from the state. So on day 14 or day 15, after we've had normal data for 14 days after coming off of the list, it has no implications for other businesses, only for schools K through 12.
Okay, thank you for clarifying. My second question is in regards to contact tracing. You gave a statistic that said 96% of your case investigations had been successful, but in terms of the actual work of contact tracing, how successful are you in terms of reaching the contacts that have been offered by the infected, and what about compliance? Do you have any specific metrics on those?
Yes, we actually do, and we will start releasing that information shortly. We look at, for case investigation and for contact tracing, we look at the initial contact. What percentage do we reach for the initial contact, day 1, day 2, and then we look at the completion rate. And as stated, the initial contact for both case investigations and contact tracings is over 90%, and that was our metric that we wanted to achieve that was submitted with our attestation form. And that's the initiation, but it is also important to understand how many were completed. And we will be posting that information on our county's website so that there's transparency with that. And we probably will do that maybe on an every 2-week or a monthly basis.
So completion also suggests compliance then, right?
No, that has not, that's completion.
Compliance.
Completion of the staff's work in being able to reach individuals. We also, what is going to help us extend for those individuals, because some people may not want to answer their phone, they may hang up if we call them. We are going to utilize our promotors to go out into the community and identify individuals that we have not been able to contact. Does that make sense?
So at some point, will you have but at some point, will you have a report on how many people are complying with either the orders to get tested and or the quarantine?
So complying, thank you, Sasha, for clarifying that. After a case investigation occurs and the contact tracing interview occurs, individuals adhering to the isolation and quarantine orders, you're absolutely right. We don't have anyone to keep an eye on every individual for 24 hours. So this is an honor system. So and most people are complying. But if we hear that people are not complying, we will take action as necessary. Thank you.
Thank you very much for answering my question.
Okay, we'll go to the next question.
Brandon Lewis, CBS 8.
Yes, I have two questions. The first one is I wanted to know if the Cal Ready delays are having an effect on San Diego and whether that might be making our case rate higher or lower because of the Cal Ready delays.
Okay, Dr. Wooten.
I thank you for your question again. We've shared that we had additional cases reported due to the backlog at the state on Friday and Saturday. And at this point, and again, through conversations with the state again this morning, we think that there will be very little impact going forward based on the information that we know now to us. We have a web CMR or an electronic laboratory reporting system where the cases come directly to us. The only cases that were backlogged from the state were those cases that were reported from one or more commercial laboratories. So our public health laboratory results, our hospitals, our clinics, those results are reported directly to us. So the impact that was to us on Friday and Saturday was an increased number of cases. So we think we are beyond that issue now. Thank you.
Thank you. And my second question is that CDPH says on its website that as of August 7th, it's not allowing any county to come off the watch list or get put on the watch list until the Cal Ready system is fixed. So in the conversations that you've had with the state, I know you talked about this briefly, is it your understanding that that will change and that it will still allow us to come off despite that position?
Yes, they will be making the determination regarding that this weekend. That's what we have been told. Thank you.
Okay. Thank you.
We have one final call-in question.
Paul Sisson, the San Diego Union Tribune.
Thanks for taking my call. On reopening, you've seen a lot of outbreaks since a lot of businesses are forced to stop operating outdoors. We've seen the largest concentration of community outbreaks, as you just showed today, in restaurants and restaurants with bars. As you go toward a new phase, what do you take with you? What have you learned? How might restaurants and bars be allowed to reopen indoors differently, kind of informed by what you've seen so far in these outbreaks?
Okay, Dr. Wooten's going to come up and respond.
Thank you, Paul. I think you've been on vacation. Welcome back. In terms of what will happen with the restaurants and bars, we know that the gatherings, and not all restaurants and bars have violated the health officer's orders. So that's where our compliance program will come in and help to monitor the issues going on there. But we are relying on the state, with input from health officers all over the state, on how to reopen up, if you will. So that information is to come. I don't have any guidance about what that will look like at this time. Thank you.
I just know that you're sending out personnel every time you see an outbreak in one of these locations, and you're talking to people, you're interviewing them, and you must have some thoughts in terms of what types of behaviors in these locations are leading to the outbreak. So I thought you might have some insight in terms of, here's what we've seen, here's what people need to stop doing when we do go back into those locations.
The behaviors are the very behaviors that I emphasize at the end of my update every day, and that's related to social or physical distancing and wearing facial coverings. Those really are, and sanitation and personal hygiene, and just individuals not going out into these locations when they are sick. those, and as it's evident, based on the decline in our case rate and the decline in daily numbers of new cases, is evidence that those things work when we adhere to them. So we're just going to have to be more vigilant going further, and we will utilize our compliance program to help drive home these best practices.
Is it your sense that it's really mostly the patrons who have not been quite following things, or the staff at these locations have been? Is it really just pretty much on the patrons to get this right next time?
It is not all patrons, it is staff. Some outbreaks are staff only, some are staff and patrons, and some might be patrons or mostly patrons. It's just individual behavior, no matter what your role is, whether you're a patron or whether you're a staff member.
Yes, thank you. And one other quick question. I had a comment from a local leader today who was somewhat concerned about the new PED East testing.
Paul, I'm having a bit of a problem hearing you. I'm so sorry.
Oh, okay. I'll let you go. Thank you.
Oh, no, welcome to get your question. I just couldn't hear you.
Oh, sorry about that. Can you hear me now?
Yes, very good.
Okay, I'll speak up. So in regarding the PED East new testing center that opened yesterday, I got a community leader today who sent me an email and said they were concerned that this was on Border Patrol property and that might reduce its overall effectiveness and willingness of people to come in. Can you say a little bit about how that ended up on Border Patrol property and whether there's an opportunity to maybe move it to non-Border Patrol property?
Say a little bit about how we decided or landed on that?
Yeah, how did it land there and how
Okay.
might it land somewhere else?
Yeah, I'll start, and Supervisor Cox, basically looking at where the need was. That's one thing. Individuals in South Bay have, that's the hardest hit area. Number two, we know that there are U.S. citizens and permanent residents that are crossing back and forth. And we also know the third factor is we have essential workers that are coming into San Diego. Supervisor Chairman Cox.
Yeah, Paul, thank you for that question. We actually had a upcoming text question that was asking for the statistics, and I gave that earlier, but I'll do it again real quickly. We had 78 tests that were given yesterday, the first day of operation, 118 today. We are going to extend the hours of operation. Right now it's from 6:30 till 10:30 a.m. That'll be the hours through tomorrow, and then starting on Monday, we're going to start from 6:30 to 12 noon. The question in regards how do we get here, I know early on we had some discussions with the federal administration trying to see if we could get them to provide this type of testing, and we were not successful in getting them to agree to step forward and basically cover the costs of those tests. And so over the last couple of probably 5-6 weeks, we've been working with Customs and Border Protection. They've been extremely cooperative to allow us a site at the PED East location, and we are providing free tests there. We don't ask personal questions in regards to nationality or where they live, but these are people that have been deemed to be legal to cross into the United States, either because they're permanent resident aliens or, that they have essential worker status, so they're working on this side of the border, or they could be American citizens that are coming back and forth on a regular basis. And I think, again, we're very appreciative of the federal government's cooperation. This is one of 3 sites that we have in the county for COVID tests. Obviously, the PED East location, California State University San Marcos, and the Tubman Center. So we're delighted to see, and these costs are all being picked up by the County of San Diego for these test sites. Does that answer your question?
I just wondered, in terms of the procedure voting committee, they were saying when they talked about that it was on Border Patrol property would reduce overall effectiveness. Some people would be less inclined to use the facility or anything like that. And I just wondered if you agree with that. It sounds like you're saying that, a lot of the folks that are coming across the border, are allowed to come in and cross. I think,
Paul, we're having a real hard time understanding the communication that's coming across. It's kind of a little bit garbled. I think what you're asking is, we do not ask personal questions. We do ask for a contact number. And if somebody that takes a test turns up positive, if they happen to live in Tijuana or the Mexican side of the border, we have a cooperative relationship with our counterparts in public health in Tijuana to follow up with those individuals. And obviously, if they have contacts, phone numbers on this side of the border, then we will follow up with them. Let me ask Nick Namashian if he has any other comments. And if we didn't answer your questions, we'll give it one more try. Just maybe I don't know whether you're too close to the microphone or too far away, but we'll try to respond. Here's Nick.
Thank you, Supervisor Cox. And Paul, thanks for the question. The reason why we don't have a concern is we've been working in decades with the Health and Human Service Agency there at the border and with the Border Patrol in times of when we did Hep A or flu shots. And so this has been pretty natural. But two of the lead workers at that site actually live in Tijuana. And they're Health and Human Service employees living in Tijuana, and they're crossing the border. So the customer service element, the cultural responsiveness, very important to us of the staff, the county team that's there, that's engaging and welcoming. So we're going to see those numbers rise. As the chairman said, we're expanding the hours. But I think it's a really key point that you're making, that it's the people there and the engagement we're having as they're coming out and building that type of trust and relationship with folks that will welcome taking the test.
Thank you.
Hey, Paul, I just want to make one more comment. This is not unprecedented. During H1N1, Customs and Border Protection allowed us to set up a vaccination clinic just as people exited coming north from Mexico to U.S. So this, again, is as Nick was saying, we've had decades of collaboration and cooperation in working with Customs and Border Protection. And more than likely, once vaccines are available for COVID-19, we will have stations there to do the same thing. So thank you.
Thank you.
Dr. Wooten, this is the first text question from Will Huntsberry with the Voice of San Diego. It is a question about unlicensed childcare. He says, my understanding is that over the summer and during after-school hours, camps like the YMCA are allowed to operate. Many places like that have shown interest in providing a day camp similar to summer camp that will also operate during the school year, since schools will be online mostly. My understanding is that current regulations will not allow those camps to operate during normal school hours once the school year begins. Is that correct? And do you think there could be a waiver for such programs to operate?
Even though it was a long question, I have a short answer. The first question is, yes, you are correct. Our health officer's order did allow for the development of youth camps that were pretty much established on the basis of childcare. And then what has happened, the second part of the question, there was an executive order that the governor issued that could extend two programs that were funded to provide child care. That executive order expired on June 30th. So there is advocacy, and we've even advocated at this level to the state to extend that. But I understand, based again on conversations with the state today, that there will be some guidance coming out, if not tomorrow, over the weekend. So yes.
And Dr. Wooten, this next question is from Lindsay Winkley from the Union Tribune. She has some follow-up questions about the state watch list. She wants to know why gyms and places of worship still have restrictions in place after schools come off this watch list, that these businesses do not, if schools are open, why do these businesses need to remain closed? And are we awaiting further guidance for this?
So yes, as we have stated numerous times today, and even today's Thursday, on Tuesday, that any additional opening up of business operations will have to come from the state public health officer. So, and that's in the current health officer's order that was issued on July 13th. So, coming off of the state's county monitoring list, right now has only impact on schools K through 12. Any openings up of other businesses, other sectors, that guidance will and must come from the state. And again, we don't want to do this flip-flop back and forth. We close down, numbers go down. We open up, numbers go up. We want to, and the entire state wants to implement a very intentional and thoughtful process that supports the businesses, but also maintains the whole process of not having increased numbers of cases. And obviously, you've seen what we've done throughout the state has worked. And we want to thank all of the businesses for their cooperation.
And Dr. Wooten, a further question here from Mary Plummer with iNewsSource. What steps, if any, is the county taken to address people's fear of going to the doctor or hospital right now?
So there have been several attempts, and we continue to try to include that information in our press releases. We've brought in our community medical and healthcare partners to convey those messages. And actually, our local healthcare system has outreach and media outreach on television that talks about the very same thing, encouraging people not to overlook their medical health and not be afraid to go in to seek health care for non-COVID-19 medical issues. So it's a continual process, and we just want people to continue to understand that process. Don't be afraid to seek health care. Call your doctor. And now much of medical care is being conducted via telemedicine. So in many cases, you may not need to go in face-to-face, but some conditions necessitate a face-to-face contact with your healthcare provider. Okay.
Okay, this last question has to do with large group businesses, and we'll go ahead and hear the question.
This one is from Matt Hoffman with KPBS. The group called the San Diego Events Coalition held a rally outside the county administration building this afternoon, asking for help to save the live event industry. In part, they are asking for 20% of the San Diego County grant funds set aside for the events industry. Is that something the county is willing to do?
Well, I mean, it's a big industry in the San Diego region. The Board of Supervisors last week approved the allocation of $17 million to be used to be divided up by the 5 supervisors, so they each have $3.4 million to allocate to assist businesses under business stimulus program. Each office is administering those a little bit differently. I know that our deadline is tomorrow for people and businesses to apply, and other supervisors may have a different timeline that they're working on. And in addition to that, we've provided $700,000 for each supervisorial district to be directed towards restaurants in their districts to assist them during this very difficult time. And I know Supervisor Fletcher, I think, has some additional comments.
Thank you. I think this industry certainly needs help. A lot of industries need a lot of help. To put it in context, my office alone has received close to $190 million of requests for assistance, and we have $3.4 million to allocate, which is why we continue to hope that the federal government can come through in a substantial way to try and meet the economic needs during these difficult times. During times like this is when we really do depend on the federal government that has a much greater ability to provide that economic stimulus and assistance, and so it's our hope that there will be more help and assistance coming from the federal government. As it relates to outdoor entities getting back to work, we have been working with the state. Outdoor settings provide a significantly lower risk, And given we're encouraging so many venues to move into an outdoor setting, I believe that it would be possible to come up with safe guidance for these outdoor events to operate consistent with the guidance given to religious services or others to be physically distanced, utilize face coverings, but allow those. But as it stands right now, those are not allowed. And so we're going to continue to work with the state to try and get guidance surrounding outdoor events in hopes that some of these folks could get back to work.
Well, that concludes our questions for today. Again, I want to thank all the folks that have either called in or texted their questions. I want to really try to end with a positive note. The week of August 9th through the 15th is National Health Center Week. It's an observance that's held each year highlighting and celebrating the mission and accomplishments of America's health centers over the past 5 decades. This year's theme is Community Health Centers Lighting the Way for Healthier Communities Today and in the Future. The County of San Diego, through its Live Well San Diego vision, has worked hand in hand with our community partners, our health centers, to create a region that is safe, healthy, and thriving. Now, during this pandemic, our community health centers are playing a very vital role in the region's response to the pandemic. In my district, I'm fortunate to have such great, outstanding organizations as the San Ysidro Health Center, Family Health Centers, La Maestra, Operation Samahan, and the Imperial Beach Health Clinic. And I know my fellow supervisors have a great health partners in each of their districts as well. I want to thank them for all of their hard work and support during this critical time and wish them a very happy National Health Center Week. Excuse me. We are not scheduled to hold another briefing until Monday at 2:30. However, our coronavirus website will be updated regularly and our communications staff will continue to update the media. Excuse me. So please stay safe, San Diego, and protect yourself and protect others. We'll see you Monday.